Here at Gundu, we see a lot of children come through with glue ear or language delay. There's a high percentage of children that presents to ENT clinics.
Torres Strait Islander children are 5 times more likely to have an ear infection rather than non-Indigenous students. So as a teacher working in an Indigenous community, it's really important to be aware of that and making sure that every child's general health and well-being is taken care of so that we can really focus on the teaching and learning.
Some of the signs that I pick up on, if they're tugging or pulling at their ears, if they're putting their hands over their ears, crying a little bit, it sort of indicates to me that they're in a little bit of pain. I'm always looking at their ears for liquids or anything coming out, if there's any gunk in their ears as well.
We have one child with the ear problem. He was very loud at times. His learning was slow because he couldn't hear properly and therefore couldn't follow instructions. It also affected his speech.
We try and tackle it before it gets too serious, before there is a loss of their language and their hearing.
One of the things that educators can do to help kids keep their ears healthy is to make sure that they do what we call the Breathe, Blow, Cough, Wash program on a daily basis, and it's recommended that they do it several times a day.
The nose and the ears are all connected, so we wanted to encourage the children to blow their noses to clear their ears. To help the children in our centre, Gundu, we got up nose blowing stations, so it's a little mirror with the tissue boxes as well as hand sanitisers.
If I see the slightest trickle of green coming down their nose, I send them to the tissues straight away. I even follow them and make sure that they are actually blowing and not just wiping.
We have to make sure we're teaching our children hygiene, washing your hands after blowing your nose because it's stopping the spread of germs.
In the bathrooms, we've got a washing hands visual. There's actual photos of the kids washing their hands. They don't really get purpose from a picture of a cartoon. If they can see themselves doing it, it can jog their memory and go, oh, this is how I'm supposed to do this task.
The younger ones are blowing their noses more often, so that's a real plus for us.
We have a hearing specialist that I can talk to as well, which is really great. I talk to parents as well.
Many of the times we do point out that we've noticed there's been some ear health concerns. We just consult with our parents then if it's okay to refer them down to our local child health nurse.
A lot of the parents coming through now are first-time mums, young mums, and sometimes they don't know them things. When parents see that you respect their children, they then begin to trust you more, and then you can offer your help more there then as well.
I think because of our community so small, we know which services to utilise. We support each other.